get to a point where COVID is not inhibiting our society, not inhibiting our growth. To do that, we have to be at 70%. When we hit 70%, then I feel comfortable saying to the people of this state, we can relax virtually all restrictions. We're at 68.6, almost there, but this isn't horseshoes. We want to be at 70%. 1.4% to go. And then we can lift the capacity restrictions, social distancing, the hygiene protocols, the health screenings, the potential tracing. Masks will only be required as recommended by the CDC. There will be some institutional guidelines, large venues, schools, public transportation, hospitals, nursing homes. But we hit 70%, we will be back to life as normal, or as normal as you can be post-COVID. So how do you get the vaccinations up? And the vaccination rate has slowed dramatically, which is obvious. The higher you get, the fewer people there are to get vaccinated. And the lowest vaccination demographic is still the 12 to 17 because they just became eligible. And we just spent a year telling them this is not really about you, it's about older people. So we're trying to get it up in the 12 to 17 group. But focus on the places that have low vaccination rates. Well, how do you know where you have low vaccination rates? Study the data. We have 1,700 zip codes in the state of New York, okay? If you look at the zip codes by vaccination rate, the bottom 10% of the zip codes are below 36%, okay? The overall vaccination rate in the state is 68. So these zip codes are like almost half of the vaccination rate. Target those areas. Remember when we went through the hospital vaccination protocol early on and we couldn't get the hospital numbers up? And I then literally did the numbers by hospital, and now people knew that we were looking at hospital numbers and there was more accountability. We're going to do the same thing with zip codes. Yes, we're working statewide, but we're going to focus on these zip codes, and I want everybody focusing on these zip codes because they're dramatically different. This is starting with the lowest percentage of vaccinations, right? Muncie and Rockland County, Romulus and Seneca County, Monroe in Orange County, Spring Valley in, well, Monroe and Orange, and then Rochester and Monroe. It's a little confusing. Monroe in Orange County, Rochester in Monroe County. Spring Valley, Evans Mill, Frankenville, Gowanda, Far Rockaway, Queens. Williamsburg, Brooklyn. Rochester City in Monroe. Ocean Hill, Brooklyn. Canarsie, Brooklyn. Brownsville, Brooklyn. Buffalo, City of Buffalo and Erie County. Crown Heights, Brooklyn. Borough Park, Brooklyn. Delavan and Cattaraugus, Baychester in the Bronx. Addison and Steuben, Fort Plain, Montgomery, Hunts Point in the Bronx. Jefferson County, Marine Park, which surprises me. And if you have, this is not just a remainder of the zip codes and their vaccination rates, it is also an IQ test. Who can read the top county or town? Anybody? Okay. Then you'll have to look at it on the website. We'll skip this chart. But that is the remainder of the zip codes of the 176, and we're going to be focusing on those. To the county health departments and local governments, I say, focus your resources there. That is where we have the greatest chance for advancement. And the local governments have the resources because the vaccination rate is way down. We don't have enough people coming into vaccination centers to justify having the centers open right now. We have centers open all day and 2, 3, 4 people show up. So redeploy those assets to these zip codes because that's where it can make a difference.